Hey everyone! My name is Sarah Johnson and I'm a Pediatric Occupational Therapist and part of the Infant Development team here at Emerge Pediatric Therapy. I'm here today to talk to you about a change in the CDC Developmental Checklist and what this means for your child, specifically in their development from birth to 5 years of age. So first, a little bit of background. The CDC has a program called Learn the Signs, Act Early, which is funded by the American Academy of Pediatrics, and it's looking at updating the current developmental skills checklist. So the goal of changing these guidelines, which were last updated in 2004, was to clarify when most children can be expected to meet a milestone, and it was also to discourage a wait and see approach and see when additional developmental testing should be administered if a child was not meeting milestones. So this resulted in a couple different changes. So some milestones were actually combined, some were removed in duplicate areas, or if the wording was not clear of what achieving that milestone meant. Some were moved to different age groups, and then also some milestones were either added or removed completely from the checklist. The CDC also changed what this is called. So it's now called a developmental surveillance checklist, and it's a monitoring tool used by caregivers or professionals to observe how a child grows and changes over time and whether a child meets typical developmental milestones in playing, learning, speaking, behaving, and moving. One thing the CDC did note with this change is that the checklist is not a substitute for specialized evaluation in the area of concern. And that is a really important thing to note, that this developmental checklist is meant to be used by pediatricians at scheduled well-child checks, and the milestones are meant to line up to when a child would be going to the doctor and used as a starting point to talk about any concerns parents might have or look at overall development. So prior to the update, the guidelines were looking at the 50th percentile. So looking at a milestone, you would say that at, for instance, 6 months of age, 50% of kids should be sitting without support. What they did now is they actually changed it to capture at least 75% of the children at that age would meet the milestone. So their reasoning for this is that if a child is not meeting it at that time period, they are in the lower 25% of that area, and that is when we would want to flag for possible early intervention. The milestones are broken up into 4 main categories, and those are social emotional, language communication, cognitive, which is learning, thinking, and problem solving, and then movement and physical development. And what we're primarily going to talk about today are the movement milestone changes, which would be more applicable for children that are in occupational therapy or physical therapy services. So I wanted to highlight a few of the main things that changed in regard to the movement milestones. The first is actually no mentioning of rolling until 6 months of age. So previously, we expected infants to roll from their stomach to their back between 3 to 5 months of age. This has now been moved until 6 months of age, and it's actually only talking about from your tummy to your back. And the important thing to note with this is that rolling from tummy to back and back to tummy is one of the transitional movements that we then use in order to get from laying to sitting or sitting to crawling. It's also important to note that taking away rolling from back to tummy takes away one direction of this, and typically that if a child is only rolling in one direction, so if they're on their belly and they only roll to the left or only roll to a right, that can give us a sign that there might be an asymmetry. So taking away this other milestone means that we might miss some early asymmetries in rolling, which could then impact later development of other motor milestones. Another big change with this was that sitting without support was changed from 6 months of age until 9 months of age. And this is a pretty big change because previously at 9 months of age, we were looking for infants to be crawling. So we're kind of changing that sitting well to a time when they would then be moving around and crawling a little bit more. The important thing to note with this is that sitting well is a precursor to feeding. So typically, feeding solid foods is recommended around 6 months of age, and you look for an infant to be sitting well. So that's something that we'll be continuing to monitor to see if guidelines will change in regards to introducing solid foods, or kind of how that will line up, since there is a little bit of a gap now in the sitting now versus how it used to be. Another thing that has changed is crawling, which was typically expected between 8 and 10 months of age, has actually been completely removed. And this is something that, as occupational and physical therapists, we feel very strongly about infants crawling. There are many benefits to crawling. There's a lot of research that supports crawling. So this is probably one of the biggest things that parents have talked about in regards to the change in this milestones, is why crawling was removed. We will actually be going more in depth in this later in a video all about crawling and the importance of crawling. But the one thing that we wanted to highlight is that crawling is still very important. Crawling is vital for your child's development. It is something that, as occupational and physical therapists, we want all of our children to crawl, and it is a motor milestone that we still want them to achieve. Another big thing that was changed was pulling to stand. So previously, pulling up to stand was seen about 9 months of age. It was now moved to 12 months of age. And actually, there is now no mention of just standing alone. So working on really that balance and ability to maintain an upright posture. And we know that standing alone is a precursor for crawling, for walking. And taking out that mini milestone can mean that we're missing maybe some infants that are having a little bit of difficulty with core strength and would benefit from just a little bit more before they get to that walking age. The final milestone that we'll touch on today is walking independently, which was changed from 12 to 15 months of age to 18 months of age. And this is a pretty big change. It makes sense from the developmental standpoint, because things like pull to stand were pushed back, standing alone was removed. So the fact that walking was moved back is not unexpected. But it is something that, as occupational and physical therapists, we do expect to see a little bit earlier. So that's something we'll continue to monitor, and also look at those precursor skills and how those are impacted by the developmental checklist. There were also 2 more checklists added, looking more at 15 months and 30 months of age. So there is now a developmental skills checklist at every checkup visit from 2 months of age to 5 years of age. So the hope with this is that each time you go into the pediatrician, you'll be going through developmental milestones, and you can have an open conversation with your pediatrician about any concerns you might have. I know we talked about a lot of big changes today. We will have some subsequent videos that will talk about more of these changes and go into more things in depth. The important thing to know right now is just to continue speaking with your pediatrician as you have concerns. The new milestones, again, are going to reflect when 75% of infants are expected to meet that milestone. But if you have concerns about your child's achievement of the milestone, please bring it up to your care provider. They can go through additional screenings with you, and then if necessary, refer out for an occupational therapy, physical therapy, or speech therapy evaluation. If you have any concerns about your child's developmental milestones, or any confusion regarding where your child should be at developmentally, please reach out to us via our website or calling. We would be more than happy to talk through it with you and provide any additional resources if necessary. Thanks so much.